Awesome. So I've been really excited to be a part of the group of our Educators Academy, where we are working to try to provide a better educational experience for the residents. And I know personally, my time working with the residents, both in the hospital and in the clinic, those are always my best days. So I wanted to talk today a little bit about expectation setting and why I find it to be so incredibly helpful. And I think it just makes for a much better and more clear experience for the residents. And we'll talk a little bit about why. So why is it important to set expectations? You hear people say this all the time. We see expectations in curriculum and outlines. But the reason it's important is because they work. There have been large-scale international reviews of educational research and also many, many case reports showing the effectiveness of setting clear expectations. Personally, I find that it's an easy way to open conversations when you're first meeting your team for the week or when you're in clinic. If you can get to know the learner, ask them what they hope to gain from the rotation or the experience, what they feel comfortable seeing and managing. But it also just lets you know their background. You know, are you coming from medicine? Are you a neurology resident? Are you a medical student? And getting to know them a little bit better. I think it's really important to keep in mind when setting expectations with the team that they are absolutely not a one-way street. What expectations might seem appropriate or reasonable to you may not be what the learner is looking for. So I think it's really important to ask them what they hope to gain from the experience and things that they hope to accomplish or learn whenever you're working together. So what should expectations look like? They specifically call them SMART goals, but this is kind of just a brief summary of the highlights of what's most important when you set expectations. You want to make sure that they are specific. For example, you wouldn't want to be like, the expectations, we're going to have a great week and we're going to learn a lot. Obviously, I think that's kind of clear and it doesn't really help the learner in any way understand what to expect for the week. You want your expectations to be challenging yet achievable. And this kind of goes back to being specific, but you want to have different expectations for different learners. So obviously a medical student's expectations should be a little bit different than a chief resident's expectations. And I think that achievable portion is where you can take the opportunity to get feedback from the learner themselves about if they feel that these expectations that you're discussing are achievable. And then you want to make sure that they are measurable, and we will get to that a little bit at the end. And all I will say is that you set expectations, but you have to have a time at the end of the week that's set aside for feedback so that you can actually discuss how the expectations went, if they were met, and what could be done differently in the future to make them better. So I think this is incredibly important that you have to collaborate on your expectations. This is maybe for me a little bit geared toward inpatient, but talk to your chief resident. I can't speak for every institution, but at Duke, we have fabulous residents and they are doing this every day on the front line. So talk to the chief resident about what they think are good expectations for the team. I tend to really try to take a step back and allow the chief residents to run the team whenever I'm on. And so I think it's important that they actually think through what the expectations should be and what's reasonable. They probably are more familiar with what the medical students expect from these rotations, what they hope to gain from them, and what they feel comfortable doing. So I always talk to my chief residents first. And then as we discuss expectations, obviously involve the whole team to make sure that everybody is on the same page. Like I kind of mentioned before, always ask for feedback on your expectations to make sure that you're not setting expectations that just don't even make sense for the team. Ask the learners what their expectations are of you. We set expectations for others, but we need to do our job in teaching these learners. And so make sure that you know what they expect from you as well. And then, as I mentioned before, just make sure that your expectations are unique for each stage of learning and not just kind of these like bucket expectations. This is just brief, examples of what clearly defined expectations and goals look like. And, I'll try to put this in the outpatient perspective as well. But whenever I have people with me and we talk about how many patients I expect them to see in a day, generally it's like 2 news and a half day, making sure that they feel comfortable with that. And this is more geared toward like a neurology resident. You want to talk about how much time they should spend with the patient, how they should plan to present the patient and when, how much talking and examining you want them to do in the room. That I kind of think more about like inpatient, but it's important before you go into a room to let them know what you would like to see done and discussed with the patient. And for example, in outpatient, when we work in these subspecialty settings, I think it's really important to tell them what kind of questions they should ask whenever they approach these patients. Like a narcolepsy patient, it's not every day that you see one. So I always try to make sure that they know what questions we ask and why when we're trying to delineate narcolepsy versus idiopathic hypersomnia, et cetera. You should talk to them about documentation, what and how they should document. And then especially inpatient, talk to them about how they will be involved in their patient's care throughout the week, because obviously it doesn't just end the day of the consult typically. Generally, there's an expectation that they're going to continue to follow their patient and be aware of things like imaging and labs that we're sending off. And then I believe this is my last slide, but the important thing with expectations is that they're always sandwiched with feedback at the end of your time together. Why would you set expectations if there's no follow-up or discussion of how things went? It's how the learners learn. It's how they know if they're doing a great job, and how they know about things that they can improve on in the future. And so I know whenever I was a resident, Matt Ludke and other attendings would always do like Feedback Friday. So I've tried to make sure to implement that as well. You know, Monday, you sit down with a team, you get to know them, you set expectations, and just make sure at the end of the week that you set aside that time to give feedback as well. And then these are some of my references from today. You guys can always reach out to us if you have any questions, but thank you.